In order to better address the symptoms experienced by sickle cell patients in the Empire State, state lawmakers are considering legislation to have New York health officials designate sickle cell centers for excellence and outpatient treatment centers. The proposal would also ensure sickle cell patients can gain access to opioid therapy. For more on these proposals, as well as awareness surrounding sickle cell disease, we're joined in the Capitol Press Room by Ginger Davis, president of the Sickle Cell Thalassemia Patients Network. Before we get into the pending legislation, can you walk us through a little bit about sickle cell disease in terms of, what it is, how someone might end up with it, and I guess the range of impacts it can have on a person suffering with it?
Sickle cell disease is a genetically inherited disorder that is closely tied as a genetic mutation to malaria, which has developed over centuries as sort of a protective method from having red blood cells destroyed by the malaria parasite. And it is prevalent in every country where malaria was endemic. So, not only in Africa, India, which happens to be the second largest population outside of Africa in terms of global context, in the Mediterranean, Greece, Italy, Turkey, in the Middle East, including Israel, all of the Middle Eastern countries, Central South America, and the Caribbean. And so this is not just an African American disease, it is a global disease that impacts people from multiple ethnicities and nationalities. And here, unfortunately, it's characterized as an African American disease, and it is not. We have about 14,000 people, and that's a low estimate. And we think it's higher than that because we're sure that people who are undocumented here in this state have not been counted. But this number has been recently confirmed by New York State Medicaid. And so we have a very large population, one in the top five in the nation. Traditionally, New York State had the highest population. We got beat out by Florida. It's a New York pride thing, but that's to tell you what the prevalence of sickle cell disease in this country. It is the most common genetic disorder in the United States and globally.
And what does it mean for people who have it? What are the range of symptoms that they might experience?
First, sickle cell disease is passed on from parent to child. So one parent with the trait has a 50% chance to pass on the trait with each pregnancy. Both parents with the trait, there is a 25% chance with each pregnancy you can pass on this genetic disorder that affects the red blood cell, particularly the hemoglobin, which is the oxygen carrier molecule inside of the red blood cell. It causes a severe anemia, so the body does not have a normal complement of blood volume. And what it causes is multiple complications. It is a very complex disease. Aside from the severe anemia, because you do not have enough red blood cells in your body for normal function, it causes what's known as ischemic damage or lack of oxygen to tissue. So you can have organ damage or organ system damage because these organs and organ systems are not getting enough oxygen. So you have stroke as a number one complication and can start as early as 1 year in a person that has the disorder. You have kidney, lung, respiratory, liver malfunction or dysfunction of those organs. You have severe damage to the entire circulatory system because as the cells break down, they start to build up a mass along your vasculature that can leave a person prone to clots like pulmonary clots, cerebral clots, cardiac clots, or emboli as it's known in the medical term. And so this condition affects the entire body, right? It can cause, if you have a silent stroke, it can cause cognitive deficits in terms of memory, being able to retain information, being able to remember things like your appointments, being able to get around on your own. Severe strokes usually leave people severely incapacitated without the use of a limb. It can cause blindness. It's very complicated. And because of that, the doctors who treat this disease have to specialize in this disorder in order to provide proper care for the population. And as it stands today, not only in New York, but across the country, there are not enough specialized hematologists to take care of this growing population.
Well, let's talk about what you envision the future potentially looking like. How do you think this pending legislation, with its emphasis on so-called centers for excellence, could improve the availability of meaningful care?
The Sickle Cell Treatment Act started by parents of a young man who died after having one crisis. At 36 years old, a father, a husband, they engaged their Senator James Sanders, to draft the bill. What it's asking for is to establish centers of excellence to provide treatment throughout New York State. Today, New York City, the five boroughs of New York City, is where most of the comprehensive treatment is centered. We have counties upstate where there are no doctors capable of taking care of this order, which is causing people to travel from many counties upstate, downstate, to go to hospitals where they feel comfortable that they can get adequate care. We have people coming from Albany, Westchester, Yonkers, sometimes further away is Syracuse. We have people upstate past Albany and Rochester and Buffalo who are being sent to Syracuse, hours away, to get qualified care because after aging out of pediatrics, where you get this wraparound services, you're sort of in a cocoon, most hospitals do not apply resources to establishing continuative care for adults in the hospital that these children are born and raised in. They turn to 21 years old, sometimes 23, age out of pediatric service, and fall into an abyss. So this treatment act will allow for centers of excellence to be established throughout the state where there are populations that exist. And our concern is even if there's one person in a county, they should have access to adequate care where they are, where they have been raised. There should be a continuity of care. And it's more than just opioid treatment because pain is the number one symptom in this disease. It is pain that most people cannot even imagine, have never experienced. I think the people who understand the pain of sickle cell, number one, are people with fibromyalgia. It has actually clinically been matched to that disorder, to that other rare disease. The same intensity, the same neurological complications, the same uh, different chemicals and hormones that are produced when a person is under stress. So clinically, it has been proven that sickle cell pain does exist, but because of the racializing as a Black disease, pain is undertreated, pain is denied, pain is misunderstood, and primarily people do not get the care that they need entering in, particularly for adults in the emergency departments, right? Because there aren't comprehensive programs for adults throughout the state, because there's not enough training for providers to understand disorder. And what the community is saying, it doesn't have to be a hematologist. It can be an internist who is willing to learn how to take care of sickle cell disease, because usually in the adult population, internists are the first healthcare providers that you are encounter, or a nurse practitioner. And so with these centers of excellence, we are hoping that providers outside of hematology would be educated on how to take care of this population, that the American Society of Hematology's clinical guidelines for sickle cell would be followed as a standard. And then in addition to the Sickle Cell Treatment Act, where we're asking for 11 centers throughout the state, one in each of the five boroughs, at least one in Long Island, in Suffolk County, where there is a population that is not properly being served, and then the remaining centers be distributed in the areas hardest hit by sickle cell disease, like Buffalo, which we call the killing fields. The number of people who are dying in Buffalo after transitioning out of pediatric care is egregious, is inhumane, is uncivil, and it should not continue to happen. Getting the Sickle Cell Treatment Act passed and getting it supported by state appropriations, we are asking for money comparable to what California has received. In 2015, California first legislator gave $15 million to establish 12 sickle cell centers throughout the state. In 2019, 14.4 million, and this year it is on track of appropriating another $15 million to support these centers of excellence, which have shown over the years not only to reduce the cost for care of this population, reduce emergency room utilization, which is what's driving up the healthcare costs for sickle cell disease. It is keeping people healthier. It is improving their health outcomes, improving the quality of life. And with all of the research that is happening in terms of disease modifying medications that you can take 2 pills once or twice a day, all the way to the cell and gene therapies. We're living healthier and we're living longer. But the one barrier to healthcare excellence in New York State and across this country is the fact that we do not have continuative care in the adult population and enough treatment centers throughout the state to handle one of the largest populations in the country at an estimated 14 plus thousand people.
Well, if this bill becomes law and it's backed with the level of funding that you think makes sense, what do you estimate for the time of actually getting something like this up and running? Because as you pointed out, there are shortages of specialized medical personnel in this field, and it's not something you can just flip like a switch. So how
Right.
long do you envision it would take to actually get this type of infrastructure in place?
This is a long game. Getting the Treatment Act passed, getting it funded, we would like to see at least 3 centers established within the first year. And I would like to see those centers be in communities that are hardest hit by not having adequate comprehensive care in the adult population. So Buffalo is absolutely, we've talked with the Department of Health, with many of the deputy commissioners. We've talked with the Equity Council. We've talked with the Budget and Appropriations Committee. And in the city, we have programs. It's not perfect, but at least we have. We want to see these centers first be placed in counties throughout New York that do not have the care and where we're seeing the highest rate of death. And then gradually every year after that, additional centers could be added as we use up. So we would say it would take about 5 years to reach the maximum quota of the 11 centers that we are targeting. And we would need to see that the state would embed the appropriations for the sickle cell treatment in its budgets to make sure that even after we get the initial appropriation, that it will continue to be refunded, not only to keep the centers that are established open, but possibly support expanding them. Because we've already proved, not only here in New York, but in other states, if comprehensive care is made available, we can reduce the costs, and those cost savings, particularly to state Medicaid, could be reinvested into the program. So it wouldn't be like we're getting additional money. We would actually be using the cost savings to having comprehensive treatment reinvested in the program to keep the centers open, possibly open new centers if the population statistics demanded that happen, and or expand existing centers.
Well, unfortunately, that's all the time we have for this conversation. We've been speaking with Ginger Davis. She's the president of the Sickle Cell Thalassemia Patients Network. Ginger, thank you so much for making the time. I really appreciate it.
Thank you so much for having us. This has been something that the community has needed, and we appreciate you giving us this opportunity to talk about sickle cell in a meaningful way.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.